Okay. Now, 1 minute. Okay, 1 minute. 이거 하고 이거 있으면 내가 당연히 이거 매뉴얼하고 이거 먼저 모두 먼저 한번 보여줍시다. Okay. Welcome to my education. My education. Okay. Firstly, I would like to introduce my name. My name is Mr. An. I'm CEO of IDS Ltd. It is great honor to see all doctors. Okay, and hope to see you in Korea or in any place in Dubai or something. Okay. Okay, now I'm starting. I will start the lecture for short fractional laser. Our device name is Smart Cell. Everybody can hear? Can you hear me? Hello. Everybody can hear?
Yes, yes.
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 Okay, good. Now I will give our short laser, which is mainly using maybe three purpose. Mainly I will write down. One is surgical handpiece. Okay, surgical handpiece. Many small areas, small like some watt or some cone or some incision, more removable. Okay, so we recommend use surgical handpiece. Basically, please remember one. Okay, simply mainly you must use one. Okay, I will show you. Firstly, when you turn on the device, then you can see surgical mode. Okay, I will show you. Yeah. You can see, please press surgical, okay, please. General mode. I'm talking about general surgery is surgical mode, okay, and then, okay, then there is a smart protocol, okay, smart protocol. And there is many mode, but I recommend burst mark, okay. Yeah, and ready. Okay, this burst mark, using the pulse and energy 30 millijoule and pulse duration 400 and repeat time 50 milliseconds. This is most I recommend to use. You remember, okay? Because in my opinion, you only understanding this, this burst mark mode, you can treat about 95% or 97% of general surgery. Okay, maybe I can show simply how the beam will emit. Okay, please wait. 이상 이거 밤을 좀 film을. 야 상용아, 그래. 요즘 이상 좀 도와줘. 요거 빔을 한번 쏴줘봐요. Okay. Please be ready. When the ready. Press beam. First press beam. 안 보여. Full switch, okay. Press full switch, then beam will come out. Okay, yeah. The beam will come like this, okay. Yeah. So I recommend the beam should be come out when you treat remove more. I should stop. Press keeps press full switch. You must circling the beam, okay? Circling handpiece like when you remove more, okay? Stop. Okay. So what I'm saying is, when you remove more, the handpiece should be slowly circling, okay? Then remove target, and you can see the target and region and removal of this one, okay? In case if you use this mode, this protocol, then you need more energy. You need more penetration, then increase the energy, okay? This ultra pulse energy goes up to 55 milliseconds. 50까지 올라가요. 55까지. It goes 55 milliseconds and ready. Press ready. 그 다시 상용 돌면서 약간 서클링 하면서. 오케이. 프레스 빔. I show you press beam. Okay, stop. Okay, so in case you're using ultra pulse beam, in case you use increasing energy, then you can do more deeper, more more bigger one. Also you can do also treat, right? So key issue is energy increasing or repeat time faster. In case when you are professional, then repeat time like 30, make 30. Okay, ready, please wait. So I will show you when 30, then come 해봐. 봐봐. The beam comes very fast. Okay, stop. So we recommend ultra pulse is most safe. Ultra pulse is most safe, and you can only adjust the energy up to 30 to 55, or maybe sometimes 25, no problem. 35 millijoule to 55 millijoule, or repeat time you can do more lower. Lower repeat time is more faster, more beam. In case repeat time 20 is more faster, like this. So you just adjust repeat time and energy, and you can treat all general surgery. In my opinion, almost of treatment can be solved. Even you can adjust only energy and repeat time, right? Because when repeat time is 100 millisecond, beam is slow, 50 faster, 35 more fast. So repeat time means each beam interval time. So if it's if it's shorter, it's more fast beam. If it's longer, very slowly beam. So we recommend start repeat time with 50 millisecond. Okay, 50 millisecond. Then it's okay, and you can practice. Okay, in case you are not professional, you are not skillful, then I recommend you to practice with tomato. Okay, you buy tomato and you can selection more. 다시 한번 가봐요. 스마트 모드로 하기 전에. In case you are not professional, then go to smart protocol and press boss mark. Boss mark, right? 천천히. Okay, and ready. And stem ready. Yeah. You can you can use you can practice with the tomato. Okay, you can make tomato for maybe 30 minutes, 40 minutes, and then you must be skillful. Also the tip. I recommend the tip. This end tip, okay, end tip should be not touched, just slowly, like 1 millimeter, slightly lifting, press it, slowly. You don't need to touch this, okay? Yeah, just just lifting, 2-3 mm, and you can move, okay, and move circling, okay. Stop. Maybe I can make some, resurfacing, press pin, resurfacing. Stop. So you can do resurfacing, you can do removal and everything by skillful hand piece. So when you grip the hand piece, I recommend grip the hand piece like this, like a pencil, like a pencil, like a pencil. Okay, see, do not the last finger to be touched gently to skin. Okay, if this is skin, maybe you can press this one. Okay, and press in. Yeah, you can do like this. Okay. Stop. In case you need more, I mean, guide being strong, then you can check the guide being strong, the more strong. Okay, guide and ready. You can see the guide beam is red color, right? Yeah, so you can see the more guide beam. So you can adjust the guide beam, whatever okay, stop. Okay, so very easy. So first you remember ultra pulse. Using ultra pulse, start from 30, 40, 55, or 20, and also repeat time you can up and down, and you can adjust. You can treat most of surgery. Okay. So for I mean this surgical, I mean general surgery, normally using two hand pieces. One is 50 mm, the other is 100 mm. Okay, what different? 50 mm beam spot size small, 100 mm beam spot size bigger. I personally like 100 mm because 100 mm, 50 mm you can treat everything, but 100 mm smaller, bigger, small, more bigger, and you can treat more more easily. to the patient, I think. So it's up to you. Some doctor, use, small, 50 mm. Some doctor use, 100 mm. But, personally, I like, 100 mm, is more, easy, okay? So remember, ultra pulse, energy maybe, 30 to 55 millijoule, you can adjust. And also repeat time from, 50 to, 40, 30, like this, okay? But, when you start, initially, then, I recommend, repeat time. Maybe you can, change as, like 100. Let me see. Change 100으로 하면 되죠. Repeat time, when you start, when you are skillful, I recommend the repeat time 70. Yeah, 100 or 70 or 80, and if you are skillful, 50, skillful, 40, maybe 30, you can do, depends on your skill, right? So you must practice with the tomato, okay? So tomato is very good, and you can restart pacing, you can small, but when you remove more, if it's deeper, you don't need to go inside continuously. Just when you take out some about upper position, then maybe you can do more and keep. And second session about maybe 4 weeks later you can do additionally 4 more. Do not take out continuously, okay? So sometimes more is very superficial. You can take up by 1 time, sometimes 2 times or 3 times, okay? One more thing, in case you need maybe more strong beam than ultra pulse, then change like this. Hold on, change this one, change as super pulse, okay? Super pulse. In case you need more energy, more strong, then change super pulse, okay? Super pulse start, super pulse start 60. From 60 to 들어와봐, 괜찮아. 왜? From 60 to 100 올려봐요 한번. Super pulse, 60 to 130. So if you need, more strong energy than ultra pulse, then you can use super pulse, okay? Super pulse, from 60, 70, 80, 100, 130 millijoule, okay? Also, you can see a repeat time 20 now, right? It's very, very aggressive. So I recommend even you use, ultra super pulse, recommend to change repeat time as 50. 해보세요. Well, 60, yeah, it's okay. And then, we recommend, operation. I will show you, only remember, ultra pulse and super pulse, okay? So in case sometimes you need ultra pulse, then you can use ultra pulse, okay? I mean, super pulse, okay. But, if it's some strong lesion or some very hard lesion, you can use, super pulse. Maybe I can show you ultra pulse, what energy comes, okay? I will show you ultra pulse. Yeah, press me. Yeah, you can see some ultra pulse, looks very strong. I can show you. Ultra pulse 70 한번 나와. 70. Now I will show you ultra pulse energy. Okay. 아니, ultra pulse에서.
여기도 70요?
울트라에서. 아니, 미안, sorry. I'm sorry. Super pulse? Super pulse energy, maybe I can start, maybe. Yeah. 75, for example, yeah. See, like this. Yeah. See this one, okay? Yeah. So you can see, ultra pulse. In case you need, ultra pulse not enough energy, then you can change the super pulse, okay? Only remember, ultra pulse and super pulse. No other, like normal pulse and as continuous, do not use. Only ultra pulse and super pulse, you must use them. That is okay. But mainly, I personally like you use ultra pulse about 90%, maybe 10%, maybe super pulse. You need more, more energy, right? So only remember ultra pulse or super pulse. And the handpiece, 100 mm, 50 mm. I recommend 100 mm, more better. But it's up to you, because 100 mm beam support size more bigger than 50 mm. Okay, so you can just, when you selection more, for smart mode, and you can practice, okay? Increase and decrease energy. That's it, okay? Yeah, simple, okay? So actually our beam is, not so painful, okay? Because we are using very high technique of, a short pulse, short pulse duration, with high peak power. So, our beam is, very mild and, very gentle compared to any other, European or any other manufacturer, right? So our short laser, we are most big sales company of, short laser. So, hope you can enjoy, our general surgery, okay? And also there is, another mode for dental, but I think you are not dentist, so I don't need to teach, dental, because there is, dental surgery, but, this is only dentist. So, in case you must use general surgery protocol, okay? General surgery, yeah. So, and also main is, you can use a bus mark, you can treat everything, okay? So you can, in case even bus mark, you can up and down, adjust energy or repeat time, then it's okay. You can treat, most of, surgery, I think, right? Yeah. For your understanding easily, I can, make some, freckle or, what like this, but, bus mark, you can do everything, right? I think, right? Yeah. So any question about, general surgery, surgical mode, please, tell me. I will listen your, question. Do you have any question of, general surgery?
I have a question.
Yeah.
There are two handpieces.
Yes.
Can you show what's the difference between the two?
Yeah,
For
20,
surgical.
one is 50 mm, focusing focal length is 50 mm. One of the 100 mm focal length, longer. So focal length longer is more big spot size. Okay. So that's what I'm saying. I recommend, I personally like, 100 mm, is more, easy, with big spot size, right? So, I like, yeah, there is 50 mm, 100 mm, but, 50 mm, maybe,
Can each one can be used instead of other?
yeah, you can select whatever you want, but 50 mm in case you need cutting, you are cutting like a skin tag, maybe 50 mm is more better, okay, more sharply cutting, okay.
Okay.
But as I mentioned, most important is, you must practice with the tomato, very skillful hand piece, okay? So hand
Okay.
piece should be, the last finger should, touch it gently, not press, gently touch, and you can move very stably, okay? Hand piece, not move like this, just, keep one finger to the skin, and then you can move like this, okay? Very important. So you must practice with tomato. Yeah, what is the best, stable condition when you're using over this one, okay? Any question more? I will, yeah. So, only, it's very simple, using, regarding for wrinkle treatment, we do it with laser pacing hand piece, not surgical model. What is the difference? Okay. Wrinkle, very occasional. Wrinkle, we recommend to use fractional hand piece because wrinkle area need to know multi-beam, right? Multi-beam for, wrinkle area, right? So we recommend, we have a fraction and piece, right? We recommend the fraction and piece. In case you do wrinkle area, then, how you can do, control the beam, with the surgical hand piece. Not easy. So wrinkle, we recommend using, fraction hand piece is more, better because, in case wrinkle means, for example, if wrinkle, on the face, we recommend the full face, fractional, not only for wrinkle area, because I will explain again, but when you do fractional, normally, we recommend the full face, not some area of, wrinkle area only. No, because in case full face together, then, it will be a good, treatment result. So, only wrinkle, resurfacing. I mean, hold on. Regarding the fine wrinkle treatment, yeah. Yes, fine ink also, fractional NDPs, is better, no different. Only different is, surgical beam and fractional beam is, beam comes multiple by fractional. Surgical beam, by one shot like this. So in case we don't have any fractional NDPs, maybe we can do, wrinkle by, by moving, surgical NDPs. But now we have, fractional NDPs. So you don't need to use, surgical NDPs more. Okay, yeah, you don't need to use it. Long time ago, without fractional, maybe we can do, surgical handpiece can be, wrinkle, treatment by, emission, right? But now we are using, fractional handpiece. So fractional handpiece is both fine wrinkle and, a deep wrinkle, both, depends, when you're using, fractional handpiece, you can use, a more strong beam or more, more weak beam. But, I recommend we have also protocol for wrinkle, from fractional mode, okay? So now I'm going to enter the fractional mode. Is okay? 천천히 가요. 천천히 가요. 모드로 가서. Fractional beam, okay? So, okay. Back. Mode selection. Okay. Stop. Keep it. We have two fractional. One is fractional mode. The other is low pain fractional. Okay. So firstly, I go to fractional mode. Okay, fractional. Press fractional. Okay. Yeah. Then there is a smart protocol. Press smart protocol. Smart protocol. Skin tightening, wrinkle, large pore, acne scar, resurfacing, stretch mark, laser peeling, loving mode, and blah blah blah. Okay. Basically, laser peeling and lobbing mode the same. Okay, same meaning. Okay, I will show you later. But you must remember skin tightening, wrinkle, and large pore. It depends on energy more deeper or not less less deeper. That's it. Okay. For example, skin tightening, resetting 36 millijoule. Press skin tightening. Okay. Yeah. Energy comes about 36 millijoule, right? Okay. Some dark skin, maybe need to, reduce energy, like, 30 millijoule or 25 millijoule, no problem. Okay. But, for 36 means, generally, we recommend 36 millijoule for, skin tightening, right? And there is a very important issue, density level, 13, right? Density 13 means, when you're setting density level 13 means 그 beam 몇 샷이 나오나 봐요. The beam, will come out, 144. Okay, fractional beam spot size 15 by 15, 144. The dot will come out, when you press full switch. Okay, in case density 가봐요. In case density level 14, 올려봤어요. 14. Then density level 14, then, the beam, 가봐요, 다시. Beam, beam quantity is 169, it is more beam, okay? So density very important, okay? In generally, we setting density level, normally, Asian skin 100, density 13 to 16 is okay. You can use density level 13, 14, 15. That's okay, right? But, so when you're using skin tightening, maybe initially you recommend 36 millijoule with the density 13, but two passes. I recommend normally 2 passes, okay? 2 passes, okay? So 2 passes means with one pass, okay, and then one more pass, because one pass only sometimes you miss beam, okay? Sometimes some erythema, some erythema, some no erythema. You can do, do it again, 2 passes, okay? So no problem. Even you do, yes, even you do smart mode, smart protocol, even you do 2 passes for fractional, no problem. But key point is, after finish, operation, you must do cooling for long time, about 40 minutes or 50 minutes for long time, okay? Long time is very important. Because when cooling long time, then you are very safe. When cooling is very short time, patient feel very hot, right? Very hot, right? And feel not comfortable. When you do cooling for long time and some mask pack or some air cooler, then patient very comfortable. So Korea, when they do fractional with two pass, okay, two pass, and they do cooling about 40 to 50 minutes, and after laser many erythema, but after cooling no erythema. So you must find out how to cooling without erythema when patient go back to home, right? So during operation it will be readiness means erythema, but after cooling 40 minutes 50 minutes, Korea place surgery, they go patient very comfortable when go out, right? No heating. So very important, you must do how to cooling. We recommend many cooling. We give always cold roller, okay, cold roller we do. We recommend always serum. This is for lady doctor is for post cream, right? We recommend cream, this one or some Vaseline or any kinds of cream you must moisturizing, okay? But this our lady doctor is specified for laser cream, right? So we recommend you after finishing fractional apply this one like this one on here, and roller. We have roller, right? You can roll all area for by roller, okay? You can use the roller and for face cooling up to 40 minutes 50 minutes complete cooling, okay? And then after cooling, patient will comfortable, okay? Yeah, this is very good also, okay? You can so you can use I do not press you can use laser doctor, but this is very specified serum after after treatment, right? So we have also we have also this one, and also for patients. 한장 가져봐요. 한장 거. 네, 요거 작은 거 가져봐. You can after fractional laser you can cooling this one, okay? Cooling about 40 minutes or something like that, okay? You can do it. Cooling is very important. So I repeat, in case you do skin tightening, I recommend 2 pass, okay? 1 pass and 1 pass again, okay? And then after that, cooling about 40 to 50 minutes, okay? Okay? And then, apply this, moisturizing cream or EGF cream for 5 days or 6 days, okay? 5-6 days. And then, when you finish fractional, every day, you must apply, sunblock cream, right? Sunblock, now 40 minutes. 40 to 50 minutes cooling. As long as you are doing cooling more and more, it's better. And also we have also patient, laser cream, okay? So this is clinic, this is patient, okay? So you can, you can ask, Worldgate, right? So you can, we recommend this, cooling 40-50 minutes completed, then, patient is very comfortable. So skin tightening, wrinkle, you can 2 pass, okay? No problem. And then cooling, 40 minutes, 50 minutes, okay? The other cooling is air cooler. We also supply, Worldgate to air cooler. You can use air cooler. Air cooler is very cooling, very air. Yeah, this is air cooler, okay? This air cooler, it goes minus 25 degree. You can cooling, with the rubbing and cooling, okay? Cooling the patient. So you can do cooling, basket pack, or you can do cooling with the laser doctor, with with the ice, this ice roller. You can cooling with the air cooler. Many things you can do, but cooling is very important, okay? So in case you do acne, scar, or wrinkle, 2 pass, no problem. But cooling, very important. Okay, now I give some tip to make more increase density. This in case this is for patient serum. In case you need more better result, increasing density up to 15. Now density 14, 15. Frankly, white skin, like skin type 1 or skin type 2, they are using density up to 16, 17. It's okay, but we are Asian, right? We are dark skin. So I recommend, 13, 14, 15 is okay. And even you use, density of 15 is okay. But key point is, you must do cooling very long time, about 40, 50 minutes, okay? And do you have any question? Okay. When smart mode, okay, we recommend you can choose smart mode, easily, okay? And how we can choose the shape depends on what. Okay, you don't need to use triangle and pentagon. Only I recommend square beam or round beam, okay? Because pentagon or triangle not so useful, frankly, okay? So I recommend square beam or round beam, okay? Now I will show you when using round beam, okay? Now I show you. go to 저기 스마트 모드 러빙 모드로 가보세요. 잠깐만 화면을 보여주세요. 자, stop. 러빙 모드 레이저 필링 same meaning. 러빙 모드 레이저 필링. Okay. Only loving mode is circling and peeling. I will show you. Loving mode is for kind of peeling. Yeah. Okay. Press beam. Yeah, you can peeling and moving. You can peeling and moving, okay? Stop. I will show you. I will show you my 해보세요. Stop. 자, I can see, I can see my finger, right? Finger. You can peeling like rubbing means moving and peeling. Okay, so keep press, okay, keep press and then moving, hand piece. Okay, then you can do some peeling effect. Okay, yeah. Okay. Faja Russell. Okay, yeah. Go ahead. Okay.
Hi, how are you?
Fine. Yeah.
Thank you for this nice meeting.
Okay.
I have a question regarding we have 5 level for depth. Can I use any depth 2, 3, 4 skills researching?
I mean depth level, right?
Yes.
Oh, verification. Okay. Depth level, okay, you can use, okay, but please listen. We presetting normally depth level 1, okay? Because in my opinion, in case you need more energy, you need depth, okay, depth level 2, 3, 4, 5 means depth level 2 means come beam twice. You cannot see the visual, but depth level 2 means double energy. In case skin tightening 36 with depth level 2 means 72 millijoule, double. Okay. In case 18 depth level 2 is 36. So my personal requirement is you don't need to depth level 2, 3, 4. Only increase the energy is more better. My personal thinking, right? It's up to you. You can in case depth level 2 means if display 18, depth level 2 means 36 millijoule. So you don't need to go, you just one time 36 millijoule is more recommendable. My personal requirement, okay? But why we make some depth level 1, 2, 3, 4, 5? Because long time ago, about 10 years ago, when we make fractional laser, at that time the energy maximum 40 millijoule. But now our fractional energy goes 300 millijoule. It is increasing sharp energy. Before 40 millijoule long time ago, now the energy goes 300 millijoule. So in my opinion, do not go to depth level 2, 3, but I recommend increase energy. Like in case you need 36 millijoule depth level 2 means 72 millijoule as in depth level 1. Okay, it's more better. I recommend. Okay. Do you understand what I mean?
Yes, thank you very much.
Yeah. So depth level 2 using no problem, but I recommend using depth level 2, 3, 4, 5, but I recommend increase energy because energy increase is more. We have many, you can go to increase up to 300, but normally the maximum using up to maybe 70 millijoule more maximum in my opinion, depends on region. Maximum 70 is some high, but normally Asian skin 20 to 50 millijoule is enough, I think, right? With adjustable of density, maybe density level, maybe I can recommend 12, 13, 14, 15. It's okay, right? Yeah. But when density more is more aggressive, so we recommend cooling for 40 to 50 minutes, as long as patient feel comfortable. If possible, we recommend you to buy air cooler also, in case you do more professional. Okay. Also, okay, I will show you my I do peeling like this. Okay, my hand. So you can apply small serum, then you can apply like this. Okay, then it can be recover very fast. Okay, so serum is very good. Yeah, we cannot see. So I recommend using proper serum is very good. Smell is also very good. Okay. So we recommend the serum. You can use serum and with the a roller, so you can make some good result. Also, some patients say how many sessions? 3 sessions. Okay. In Korea, when patient come to clinic, normally there is one professional consulting lady. She consulting with the patient. Yeah, you must do 3 sessions. How to do? Today, next month, today, next month, today. 3 sessions continuously. Every session, 1 month, 1 month, 1 month. Okay, then good result. Because in case we do 1 session, collagen remodeling continues 4 weeks. After 4 weeks, collagen stop, and you can do again. Maybe in case your first session, density level 13, second session 14, third session 15, 3 sessions continuously, and that makes a good result. Okay, good treatment. So normally, Korean doctor do not say 1 session. Okay, only 3 to 5 sessions. Sometimes 5 sessions, right? But generally 3 sessions. So when you're consulting to patient, you can do 3 sessions and you can charge 3 sessions by one time. Because when they pay for 3 sessions, then they must come in 1 month like this. But normally Korean breast surgeon, or some dermatology, they don't do 1 session only. Okay. Do you know what I mean? So in case we presetting rubbing mode is some kind of peeling, and wrinkle is for wrinkle, only you can increase 4 session increase density level, maybe 30 to 40, depends on what wrinkle many, or you can increase density. Okay. And second session, for example, also I will give some tip. Okay, wrinkle 한번 가보세요. Maybe in case we do 3 sessions, then wrinkle, then see, okay, then see energy density, energy 45, right? Density 12. Maybe you can increase if the patient is a lot of wrinkle, then you can increase density 14 or 15, no problem. Okay, first 14 15 you can do, even you can increase the density more, it's okay. And then in case you do a second session, okay, you can increase the density 45 and density level maybe 14 15, no problem. And second session, no, 17, no, 12, yeah, 15. The second session, you can increase, energy 45 to 50 가보세요. Yeah, no problem. Even, one step, 45 to 50, no problem, okay? So you can increase or decrease, the energy, more or less, depends on, situation, okay? It means patient wants more result, then, you can do more. But, as long as the patient's skin is white skin, even skin type 3, some white, right? It's okay. Say, but, dark skin, we do not recommend the increasing energy so high, right? Because some dark skin, still risk of hyperpigmentation, right? So maybe dark skin, maybe you can also, you can also not too high energy, like even wrinkle, you can do reduce, 36 or 40, and no problem, you can reduce it. So increasing or decreasing energy, maybe you test shot on the side area and then see the result. When test shot is okay, and test shot means after test shot, you can see some small erythema, right? Within 2-3 minutes you can see the mild erythema, then it's okay, you can treat, right? Sometimes when you treat patient, and patient has serious edema after operation, edema, right? Like like a bubble, right? No problem. Edema normally remove 2 weeks is back to normal, but very good result. When any person has edema, it's a good result. So even some patient has edema after operation, no problem. Just maybe you can tell them to take some dexamethasone, some pill. Well, no pill, but it goes normal within 10 to 2 weeks. It's good, but after 2 weeks later, the treatment result is amazing. Okay, so edema no problem after operation. Okay, yeah. So you can do large pore. In case you large pore some serious problem, you can increase energy and density level. Okay, so density level increasing is okay, but you must do cooling after operation about 40 minutes, 50 minutes. Please do cooling very precisely in a very more time. Okay, yeah. I think cooling is very important. Okay. 요거 어떻게 하는 거지? 요거 내려갈 때. Yes. Yeah. You can, the better result means, energy increasing, density one level, 2 level increasing is good result. But, with high energy, high density, good result, but risky in case no cooling complete, right? So cooling is very important. Also, after operation fractional, we also recommend to apply sunblock cream, 50, okay, up to 2 weeks, okay, 2 weeks minimum, okay. So then it's safe. Okay. Any question? Is there any doctor doing a vaginal tightening or vaginal rejuvenation or not? Do you also do vaginal or not? Okay, in case you do not do vaginal, maybe you can do labia whitening. Okay, I will show you labia whitening. Okay, 저 가보세요. 푸덴다로. 스마트 프로토콜. There is pudenda low and pudenda. Please press pudenda. Okay. Medium, no problem. And then you can see this is labia whitening. Okay, pudenda means labia whitening. I will show you. In case the labia area some pigmentation and dark skin, then make some doing like this. The 비무장, I think I like beam more bigger side. Okay, beam is bigger side, no problem. In case the labia whitening, is good result. Okay, yeah. Skip. You just labia whitening area, you just beam emission. Okay, 2 pass, 3 pass is okay. So one nurse, open the labia and doctor, operation the beam like this. Okay, I like 2-3 passes, no problem. Okay, and then when you do labia whitening, then you must do anesthesia cream, and otherwise painful, right? You must do anesthesia cream and do 2-3 passes, right? So one nurse, opening the labia and doctor emission the beam like this. Okay, we do 2-3 passes in labia whitening. See, can you see? Yeah, can you see? Can you see labia whitening? Okay, you can do labia whitening. Okay, maybe I like 2-3 passes, and it gives amazing whitening. Okay, in case you do vaginal tightening, and I will show you also vaginal tightening, right? And labia whitening is good. Okay, so you can do labia whitening. Okay, so everything when you are not sure, then please test by tomato. Okay, by tomato. Okay, not practice to dilate it to the patient directly. Okay, I recommend practice first. No, labia whitening, no, same NDP, same fraction NDPs, okay? But after labia, labia treatment, you must clean up by alcohol, the tip, okay? Clean by alcohol by tip, okay? Yeah, same using, labia whitening, same using fraction, okay? But in case you using, the vaginal tightening, right? Vaginal tightening, you must remove this, tip, fractional tip, and then change it, and then change it, fractional, okay, the vaginal, okay? normally, any kinds of scar, for the face, it recommend up to 5 to 7 sessions. In case scarring, then, more session needed, okay? Labia whitening, even 1 session is good. Labia whitening, even 1 session is good. But, to make money, I recommend 2 sessions, okay? Let them come, this month, and after 1 month later, they come again, okay? Labia whitening. But key issue is labia whitening is good, but, after labia whitening is very, hot. So you must, the cooling labia also, okay? Very important. But, labia whitening, 1 session, good result. But, maybe you recommend to, 2 sessions is okay, right? Yeah, every our guideline, presetting smart protocol, right? Smart protocol, right? Post care is the same. Yeah, post care is the same of face, labia not so different, right? Only cooling is very important. But when you do air cool, when you have air cooler, you can do cooling air cooler for air cooler hose. You must do not stop, just moving with the distance, moving and distance, okay, and moving. And because in case you're very close, it will be some freezing. So you must do cooling or some air cooler. You can do this one. Or in case of labia, you can also do cooling with syrup or something, right? So cooling is very important. Okay. Yeah, post care labia same, same like same like yeah, face. Okay. Air cooler, air cooler 좀 보여줘. I will show you air cooler. Okay. I will show you air cooler. Okay. Yeah. 천천히 닿지 않게. Okay. This is our air cooling device. You can also open. Okay. You can also open. And you can do cooling. It comes minus 25, minus okay. Keep is about 8 or 7 to 8 degree. But when you start minus 25, it comes from here about minus 25 degree. Okay, so it comes by hose and reduce energy. You can do cooling. Okay, you can cooling. Labia cooling, very good, right? In case you do this one, you can do more cooling and concentration, small area. Okay, no problem. Okay, you can move it. Okay, so you can use it. You can open, or I like them to open to cooling. Okay, when you cooling, do this one to patient, patient feel very comfortable. Okay, yeah, very comfortable. Okay, so you can see the air cooler. Okay, yeah, the air cooler hose is very long. Okay, hose is so we are giving some long hose. Okay, you can also use long hose. Okay, yeah, so. When air cooler comes air minus 27, but it reaches to at the end point is about plus 5 to 8 degree. It's very cool. Okay, yeah. So we recommend in case you for a long time air cooler is good. In case you have also hair removal device, you can also air cooler. Maybe yeah, it's okay, right? Cooling we recommend after finish operation, but one more thing. In case you use half area, you can cooling half, and you can do another area. No problem. In case you have enough nodes, then one is you can do half and you can cooling, and another half you can do after finish half. So you can divide cooling half and half, or you can finish it after finish complete and cooling. Generally in Korea, after operation complete, then they start cooling. Okay, not half and half. But some doctor doing half and half for the patient, right? Very good. For labia whitening, normally, in case with, yeah, other model to be. Yeah, in case you mixed with labia whitening, like major therapy, but our fractional, labia pudenda, is very good. As long as you can deliver the beam properly, then the result is really amazing. Okay, in case pudenda energy setting about 33 millijoule, but you can reach about 40 joule is okay. 40 millijoule for pudenda, you increase the energy, more better result for labia whitening. So labia whitening, we setting about 30 millijoule, but you can increase about 42 millijoule because labia area is normally some kind of moisturizing. I like some wet condition. So wet condition energy reduces. So you can increase the labia whitening. You can increase energy from 30 to 40 joule. No problem. Okay. And also maybe I can show you labia whitening. One more. Okay. 다시 한번 갑시다. labia whitening. 다시. 바질 okay. Okay. labia whitening you can 보죠. labia whitening you can do okay. 안 해도 되는데 오케이 해봐요. 오케이 해봐. 그러면 labia whitening 오케이. The energy 36 joule. 오케이 이거 40까지 가봐요. 40까지. You can reach 40 no problem. 또 오케이. 그다음에 빔을 이렇게 빔은 사각으로. 그래 크게 해봐요. 크게. You can make some big size. Okay, no problem. 그래서 한번 보여줘봐요. 레디에서 보여줘봐요. You can make some labia whitening, energy 40 joule and 42 joule and make some beam, more big spot size. 손가락 조심해라. Make some beam, big spot size. No problem. Okay, labia whitening. Normally, in case you do fractional laser, then only we recommend the fractional laser and therapy laser only. Therapy laser for we have also LED therapy laser, but other surgery we do not recommend. For example, in case you do filler or Botox or anything, firstly we recommend the CO2 laser, and then 2 weeks later you can do Botox or you can do filler. But in case you do filler already, then we recommend 1 month later doing fractional laser. Okay, I repeat again. In case the patient wants the Botox and filler together, then we recommend first the CO2 laser. After 2 weeks later, you can do Botox, you can do filler. But in case the patient already do Botox already, then after 1 month later and filler 1 month later do a CO2 laser. Okay.
Okay.
Yeah, all you can do general surgery. You can use all 100 mm is okay. It's okay. Frankly, no problem. Okay, but, to divide 50 mm, and maybe I recommend when you cutting incision, small skin take cutting, you can do maybe 50 mm. It's okay, right? Yeah. Yeah, but in general, Korean doctor, they are skillful and they are using repeat time 50 and 40 and 35 more faster. Okay, but personally I recommend repeat time of when you general surgery 50 milliseconds is okay and 40 milliseconds is okay. Not so fast. I do not recommend so fast. Okay. So you must practice more skillful. Okay, so you need very skillful. You need more skillful. So practice with the surgical anesthesia. So now I will show you vaginal tightening. Okay, do you have a vaginal handpiece also? Okay, I will show you vaginal. Okay, we change the vagina and the piece, okay, by fractional, okay. You can remove a tip and put in vagina, okay. Okay, when you put vagina and the piece like this, okay, this is a vagina and the piece, yeah, and then okay, setting. So slowly, okay. Yeah, go to fractional mode, And there is LVR 1 to 3, okay? LVR 1 is, first session, 2 is second session. LVR 3 is, urine incontinence, urinary incontinence. So LVR 3 is very strong energy, okay? So we recommend LVR 1 or LVR 2, okay? Yeah. Press LVR 1 or LVR 2, okay? Yeah. And ready. Then, this is,
Just 1 minute,
we
Mr.
are
Ahmed.
using 100 milliliter, right? So we do, now we press, ready, okay? So when LVR, then okay, for example, this one put in the LVR, vagina, inside, okay, and then when when press beam, the beam comes like this, okay, you can see the beam, okay, you can see the beam, okay, press beam, okay, press beam. Okay, can you see the beam? So when you press, vagina here and press beam, then the beam will come out here, okay? You can do the rotation. You can do rotation, okay? You can do rotation, and this beam goes, okay?
Just 1 minute, Mr. Ahmed. 1 minute.
Yeah. And then after emission, you can pull, okay? Rotation, okay? Beam is coming, okay? Yeah. Beam is coming like this, okay? And then do it again. It goes up to 50 mm or 40 mm or 50 mm. That's it, okay? Because there is a
Excuse me.
solving area. So vaginal treatment about 40 millisecond or 50 millisecond in general, okay? Yeah. Dr. Faz, please, make some, make some, okay? So you can do vagina. I repeat again. When you press, put this on the vagina wall and press beam. Then beam. Then you can do locking, and you can do beam here coming. Okay, and then change direction. You can change direction. Okay, yeah, up to 360 degree. Okay, and then you can pull. Okay, pull and do it again. Okay, and then pull. And pull up to 50 millisecond. 50 millisecond means like this area, okay? Then one step, last one step is left is okay, then you can do almost the vagina, okay? You can put insert and then do from here to here, okay? So when you do, I recommend you can make some the paper like this, okay? What paper, but when you practice paper, you can put the water and then take out water, because if they're using paper, then the paper will burn, okay? So put water one time and you can take out water, then only you can see the smoking, okay? So you have some toilet paper, right? Inside you can take a small toilet paper and put water and take out, and you can practice, and you can practice by foot switch, and see the result. After after your operation, you can open the inside, okay? Maybe I can show you, okay? Simply, okay? 에너지 좀 낮춰보세요. 한번. 해봐. I can show you. 해봐. Stop. For example, so for example, it can do like this, okay? It can do, okay? You can see. So simulation. First, simulation by toilet paper, okay? You can put water and take out water, and you can operation, okay? Then you can see some, your treatment technique and skill, okay? Yeah, very easy, not difficult. Only when you finish this one, you must clean up. You must clean up, and then also this one clean up, okay? After clean up, also sterilization about 15 minutes, okay? Yeah, how to sterilize? First clean up completely and dry it, and then sterilization like 15 minutes, okay? So in case you need any, sterilization procedure, then, please ask to WorldGate. Then we will send, the, how to sterilization process, okay? We'll send the information, how to, sterilization information, okay? Yeah, sterilization, simple. You can clean up and then dry up and then sterilization about 15 minutes, okay? Yeah. So, my personal requirement is, practice is very important, okay? Practice is very important. We actually have also, automatic is automatic laser vaginal rejuvenation, but, in case you can use, automatic means automatically, vaginal, rejuvenation, but, you can use, manual. This is the manual one, manual, vaginal, right? So you can use a manual one, no problem, okay? Manual one, okay? Well, automatic. Automatic is more expensive, so, whatever you want, but, automatic, normally, people in, some European, they are not skillful, they are using automatic, but, your country people, skillful, so you can use, the vagina, okay? So when you insert the vaginal wall, you can put some, sleepy gel, like KY gel. Do you know KY gel? And, put sliding, very in front sliding, KY gel and put this on sliding, okay, like this, okay? And then, and then operation, yeah. So we have, LVR1, LVR2, and LVR3. As I mentioned, the LVR3 is, some urinary incontinence problem, okay? LVR1, 2, is good, for, rejuvenation and, vaginal tightening. So you can do, LVR1, LVR2, we recommend 2 passes. 1 pass, you can, 1 pass, do, and do it again, 1 pass. 2 pass is okay, okay? After, after vaginal treatment, make some, sexual activity after 10 days later. But, we recommend, normally 7 days is okay, but, maybe we recommend, most safe is 10 days later is okay. But, for safe, maybe I recommend 2 weeks later, for, intercourse with, sexual activity is okay. After 10 days, okay, but, for safe, in 2 weeks is we recommend, okay? Yeah. Any question? Shaman. No, vaginal, after vaginal, no, any kinds of, detergent, right? But, no special, post cooling, inside the vagina. It is healing by itself, yeah. Only, kind of some, detergent, something, no special, requirement, okay? Regarding, vaginal, after treatment of vaginal post care, I will send, PPT to Ziaman. Okay, I mean, WorldGate. You can ask them. Okay, 김 회장님, WorldGate 있잖아요. 그 post, after operation of vaginal, we will send, how to do to, WorldGate. So you can ask, Mr. Xiaman, to, and he will send it. Okay, 보내주세요. So we send, very good. Low pain is okay. Low pain. We make some low pain is when people has 2 things, very sensitive skin. Okay. Second thing, some people has melasma. Okay. You can do low pain, resuscitation, no problem. Very superficial. So low pain fraction normally. Short laser do not recommend, melasma, but, low pain fractional, when patient has a melasma issue, okay, or when patient has a very sensitive skin, then we recommend use low pain. Only low pain is very high technique, right? So our company, makes some low pain means in a very short, time, pulse short emission. So low pain is also a good idea for, kind of melasma area or some, sensitive skin, okay? Or some people, very painful, even, even, fractional, so you can use low pain, no problem, okay? But in case you can use low pain, I personally recommend, density level 15 or 16, okay? 15 density level, you increase, 15 to 16. I recommend, okay? Yeah. Low pain is good, especially low pain. You can area for this area is low pain also no problem. Okay, low pain. Yeah. Okay, today my small lecture we're also recording now. I will send it to WorldGate, and we can ask this lecture to WorldGate. Okay, then you can review again. Okay, what I'm saying. Okay, yeah. Any question, or anything, you can ask, WorldGate, or you can ask, any question, then, I can reply, okay? So our short laser, we are number one, for short laser, because, no one makes some, like, low pain, but, low pain is very good, even, melasma, okay? So low pain is very high technique, high technique of, device, okay? Yeah, yeah. So you can do, many many good things. Actually, when you use our short laser, you can make some big big money from the patient, I think, right? But generally, when you come, the patient normally in Korea, they say normally you do 3 sessions, not 1 session, okay? Because 1 session makes only 1 time money, but 3 sessions they make 3 time money, okay? Make a reservation today, fraction next month, like this, okay? Yeah. So we recommend a minimum 2 sessions, 3 sessions, okay? Some scarring, 5 sessions, 7 sessions, okay? Depends, okay? Do not confirm, 3 sessions, because sometimes scar, requirement about 3 to 5 sessions, something like that. Then you can, in case scar, improvement, you can increasing the energy and density level one by one, slowly after every session, okay? Because scar is deep, you can do increase, energy and density level one by one, okay? But do not afraid, but only cooling is very important in my personal suggestion, okay? Yeah. Yeah, personally, yeah, winter session, is good, because cooling is, because winter session is, cold area. So, some, tropical, some, hot country, they are normally using, the fractional in winter season. But as I mentioned, whenever you have some air cooler, you can do, cooling, and you can also sunblock cream, then it's okay. But, after the age of operation, do not go outside for a long time, okay? Even use the sunblock. So, winter time is more recommendable. Yeah, that is correct. Yeah. Yeah. So, cooling is very important. So winter time is more, better condition. Okay. Yeah. Better condition. Also, very important. Whenever you use a surgical handpiece removable, you can put the, this is, hydrochloric band, hydrochloric band, that area. In case you remove more, you can put this in a hydrochloric band like this. Okay. Sorry. Oh, yeah. No. Yeah. Because this hydrochloric band, protection side effect like hyperpigmentation. So we also supply this hydrochloric band, very important. If you need any the certification of listening, then we can make some training certificate for you. Okay. Any question? Okay. Everything, everything. I think everybody, maybe understand, what I'm saying. And, I can also recording now. So you can, you can ask the recording to WorldGate, and then, you can, review again this recording, okay? Yeah. In case any question, or anything, then, you can ask to, WorldGate and we can reply, okay? Yeah. Anything else?
조용하네.
이게 저긴가 본데 이름을 쓰는 것 같은데 왜냐면 이게 certificate. Maybe you need a certificate too and make your full name right correctly, right? Yeah.
원래는 제일 저기 뭐죠? 시야만에 있는데 보내면 되겠네.
Yeah. 그래도 이게 레코딩이 되니까 그래서. So I recommend also using surgical. When you're using surgical, I recommend this skin. This is we call hydrocolloid band. Hydrocolloid band, right? It is very important. Every Korean pharmacy sell this hydrocolloid band. I don't know whether Iraq sell also hydrocolloid band or not, right? 네, 김사 이거 지금도 뭐 이상해져요? 어떤 건 안 그래요?
그거 지금 안 될 것 같아요.
그러면 안 돼 그냥 공짜로 줘.
일단 좀 이거는 현재는 저도 이걸 안 해야 맞을 것 같아요.
하지 말자.
예. 왜냐면 이거 제품 만들면 그냥도 달라고 이제 살라고 하진 않는 것 같고.
Okay. Everybody is okay? Anyone say, it's okay or not, so I can, finish my lecture. Shaman,
I think it's okay, Mr. Ahan.
okay. Hopefully we can see in Seoul, Korea, okay? And everybody, always be happy and healthy and good luck, okay? And thank you for your, joining with our company. Please support, WorldGate, and, we are covering, long pulse Alexandrite and, CO2 laser and, Orvimia, everything we can cover, okay? Yeah, yeah. Wait. 이거 또 뭐야? 이거 또 올라오면 뭐야?
You have one question, Mr. Ahan.
Yeah.
Dr. Faiz asked you a question.
Sorry, you mean, cooling machine is mandatory during procedure? Not cooling machine. You can use cold roller. You don't need to, buy cold, cooling machine. But, cooling machine, they're more comfortable for the patient. So it's not mandatory. But in case you have a cooling machine, you can, more comfortable for the patient and, everybody, right? So when, listen one thing. When patient is not comfortable, they don't want to come again. So you must make some, patient comfortable after finish operation, right? So cooling machine, I recommend, but not mandatory, okay? Well, you can use, roller is okay. But, in case roller, then, there is some limitation, but, still okay. Yeah, it's okay, yeah. But cooling machine, more comfortable, because patient comfortable, then, they will come again, right? So you can make money, right? So it's not mandatory, yeah. Okay.
시야만 오케이?
Yeah, okay. Siamat cannot
Okay.
hear you.
Yeah, okay. So we can, thank you very much. Once again, have a nice day. Okay. Now we are leaving. We are now finishing the company. But hopefully, see you in the future. Okay. Yeah. Thank you.
Thank you.
Okay. Yeah. Okay. I will, recording. Okay. Thank you. Yeah.